Hello, and welcome to the Content Advantage, a talk show about content for content professionals, folks, hopefully just like you, who spend their time creating content for their customers. My name is Scott Abel, and with me today is my co-host, Megan Gilhooly.
Hey Scott, how you doing?
Great, nice to see you. How's the weather there?
Oh, it's snowing buckets. It's
We're,
been beautiful, and all of a sudden, 2 feet of snow.
we're
Here we
back
go.
in Canada.
Denver.
Yeah, all right.
Yes, I love Colorado. Anyway, so Scott, today we have a wonderful guest. So we all know that structured content is often used by technical content teams to
Yeah.
produce multi-channel output from a single source of content, yada, yada, yada. But structured content can also be useful for teams outside of Tech Docs. And so we've invited Sonja Deines to chat with us today about how her team at Healthwise uses structured content to power healthcare educational content. So welcome to the Content Advantage, Sonja.
Hey, welcome.
Well,
Yeah.
hello. Thanks for having me.
We're glad to have you. Can you just start us off by telling us a little bit about you and your work in the content world?
Sure. I am the communications manager at Healthwise. So I oversee all of the content marketing that Healthwise does. I also am in charge of our website, social media, client communications, and press and media relations. So there you have
Very
it.
nice.
Excellent, excellent. Hey, before we start the show, Sonia, let me tell our audience members, especially anybody who's new to our show, what they can do during the show. So first of all, you should know that today's show is being recorded. So if you have to leave early or if you would like to share this presentation with somebody else, wait about half an hour after the show and you can use the same URL that you're using to watch today's show that's live to watch a recording, and you can share that recording with others, and we hope that you will. Also, don't worry, we can't see or hear you, so you don't have to worry about your camera or microphone. We have no control over that. At any time during the show, you can ask a question using the Ask a Questions tab located at the bottom of your webinar viewing panel. It will clicking that button will activate a little text-based chat. You can send a message to us, but we can't message you back. So just know that if you've sent one in, we'll be aware of it, and we'll try to ask as many questions as of the presenter as our time allows. Additionally, there is some great content available to you under the attachments section of your webinar viewing panel. There is some information in there provided by our sponsor of today's show, Zoom Software, and from our presenter. There's also a couple of links to troubleshooting information, so find your way to the attachments section and dance around during the show. You can download and click on any of those things while you're watching. And also, I'll remind you at the end of the show that on the way out the door to give us a 1 through 5-star rating, with 5 being the high star rating, let us know about the quality of today's show. What did you think about the presentation and the material that we presented? There's a field that you can share some comments in a text if you'd like about why you gave us the rating that you did. Okay, let's kick off this show, Megan.
Awesome. Thanks for that, Scott. So, Sonja, let's talk about Healthwise. It's such an interesting concept. So, can you tell our audience what Healthwise does and who you serve?
Sure. No problem. So Healthwise, we create, develop, and deliver health education to different organizations. So we work with health plans, health systems, hospitals, app and web developers, and wellness organizations, and we provide different health education content assets. So we provide anything from videos, patient instructions, articles, to this short, medium, long, structured content format of health ed. So, yeah.
Lots of content.
That's super important too, and somebody, all of us, of course, get an opportunity to be a patient now and then. Hopefully not as often as some other things that we do in our lives.
Right.
But that healthcare content can solve all sorts of challenges. What problem is the structured content that your organization is producing solving, and for whom? Can you give us an example?
Sure. Well, yeah, like for health systems, for example, there's so much that they have to do, and there's a lot of burden on clinicians. So the last thing that they need to be burdened with is writing or producing or delivering health education. I mean, we need to make it as simple as possible for them. So what we do is we take that burden on. And so we do all of our in-house content creation. We have writers, we have medical writers, medical content specialists, doctors, as well as software engineers, software developers who work on how are we going to work within those systems so that they can deliver it within their workflow. So whatever that workflow is, or wherever that, let's say you have a website, whatever that CMS is that they're using, how can we give them health education that they can use quickly and easily so that patients can get what they need? You know, people need health education, and they need it to be the right kind of health education, evidence-based, not written in plain language so they can understand it, not filled with jargon. And so that's what we do. And
Got it.
Yeah.
Got it. And so you provide really content as a service. What does that look like at HealthWise?
Sure. Well, that looks like different things for different clients. But for instance, our hospital clients use our content on their website. So they will use it alongside their content so that there is a holistic experience for their patients or their consumers. So if you go to, let's say, for instance, you go to, maybe you're looking up diabetes education, you might find maybe you might find their diabetes classes alongside some health education, alongside contact information or provider information, so that you can get everything all at once. We also work with people who might be struggling with like a health crisis. So for instance, we worked with a hospital that had a measles outbreak. They needed to get information out quickly. They were able to use our information alongside their information to create a web page in 24 hours. I do have that attachment, that health story, that client story that I sent in, so people can find that. But there's all sorts of ways that you need to be able to deliver health education and health information quickly. And so we help people do that through our structured content. It can fit into their CMS. They can use it when they need it and how they need it. And that's what it looks like for us. We really wanted to figure out, how can we do this? And also, how can we update content quickly? You know, health content, just like any other content, changes. Guidelines change, the best practices change. So we have to be able to react quickly to that. And structured content is how we do that. We make the change once, and it makes it across all the content, right? So you don't have to go into each piece of content, figure out, oh, where is that? Where do we have the guidelines of, for that? So that's what structured content does. It really it creates sort of a seamless experience, not only for the people who are reading it and our clients, but also for us to be able to update it quickly and respond quickly.
I can't even imagine how important that's been over the past 9 months.
Yeah.
It's been huge. We wouldn't have been able to do it, really, honestly.
Well, this begs a question that you partially answered with your previous answer. I think you kind of dovetailed into what I was thinking of asking you next, which is, a lot of times when we talk about structured content, people are like, okay, but what does that mean? What does structured content allow us to do that we wouldn't be able to do as easily if we didn't have structured content? So what are some of the things that, because you have structured content, you can do that aren't as easy to do without it?
Right. Well, structured content, if you look at it, it's kind of like the foundation, right? So you can create these different content assets from this foundation. So you can take these short, medium, and long content blocks, and you can put them however you want to arrange them into whatever you need. So you can't, if you have, let's say for instance, you have an article that is just a long article made up of not structured content. If I need to change a word or two in this, that burden becomes very clear very quickly. So structured content gives us a way to update content across all the assets really easily. And it also gives our clients, they know that it's delivered via APIs, so that once we make that change, they have it. So they don't have to wait. They don't have to be like, hey, when are you going to do that? If they do license HealthWise content as a service, they have it updated when we make that change. That's huge
And
in the
because of
content
your
world.
and because of your process, I'm sorry to interrupt you, but because of your process involves approving the content and making sure that this is the right version.
Hmm.
Because you have structured content, are you able to approve each of the little pieces? Meaning that even if a big deliverable did change, if a little piece inside of it didn't change and it's already approved, it's still
Right.
available to be repurposed in other places, which could
Right.
help speed time to market, if you will.
Right. Right.
I imagine this also leads to trust, right? Your customers need to trust what they're getting. And if they know that it's updated and they know that you're continually sending over
Right.
consistent, accurate information, then that helps ensure that your customers trust your content, right?
It does, right. And you know, that's another big piece of it, right, is making sure that that content's consistent over the different assets that we're providing. So if you're a patient, and I know, Scott, you were a patient, you went through
Yeah.
this, but if you're reading health education or health information that's different, let's say you go to the website and it's different there. You get a patient instruction when you leave the clinic, it's different there. You go and you look on social media, it's different there. You know, this is a way that you can really create a consistent message across all your mediums and all your channels. And that is huge, especially for our clients. We're talking about health, you know, we're talking about something that
Yeah.
is life or death, that does come, I mean, people need that health education. They need it to be consistent. You don't want to be sending out different messages to
I,
different people.
I recognize the overlap here between kind of what we talk about when we're not talking about healthcare information. We often talk about structured content in technical documentation or product information situations.
Mhm.
And there, one of the drivers is that the better content experience that we provide, the more less likely it would be that somebody would need to call in and ask for additional information, which is a burden on a support center. But the burden is really heavy on a healthcare organization because the people answering the phone is not a dedicated customer support service staff. It's the same people who are providing
Mm,
my blood pressure and trying to give me a prescription and
Right.
instructions on the way out the door. Now they have to answer the phone and deal with that. So I could see why offering up that trustworthy, really valid, validated content is important for a variety of reasons in the healthcare setting.
Right. Right. I mean, it's really important. And, you know, and then you know who's writing it, right? We have, so HealthWise has written content since 1975. So we have the, like I said before, we have medical writers. We have a medical review board made out of doctors who review everything based on specialty. So they know they're getting the correct information, but they also know that we're providing it in different ways for all of the different ways that their consumer or their patient is touching their organization. Um, so
interesting.
that's what structured content can allow people to do. I mean, it's huge.
It's a
So you
no-brainer.
mentioned medical doctors.
Mhm.
Who exactly are the people that create most of the content? Is it all medical doctors and scientists?
No, it goes through a process of medical writers who are medical writers, then medical content specialists.
Okay.
Um, they start developing the content, and they really work on bringing in the research with the writer um, to make sure that the content is correct. Then from there, it will go to one of our internal medical reviewers. And once the internal medical review happens, then it goes to the outside medical review board, which is a physician who works in that specialty. They review it, and then it's published.
So
So
the
it's
approval.
a huge process.
Yeah.
Yeah.
How long does it take to kind of get through that process usually?
Well, you know, it just depends because we have so much content because we've been doing it so long, right? We have, you know, it would be different than if we were writing something new. But let's talk about COVID, right? COVID-19 happened. We had to create a HealthWise coronavirus resource center on our website, and we did that in a few days. And
That's amazing.
and I had content. Now, I didn't have very much content when we started, but they were continually adding more content. So that team was working to create new content, working within that because they knew we needed to get this out to people. People need it, and our clients need it. So, so that, we worked on that. That became our priority, and we were able to get that stuff out the door. We now have a ton of assets on that coronavirus resource center, and we're adding more every day as things change. So, it doesn't have to be, if you have a process and you know what it is, and everyone knows their role, and that's how I feel structured content is, right? It's like, you take these blocks of short, medium, long content. You can then arrange them however you need them to work for whatever asset you're creating. It's so much easier to work with, right, when you have that.
Could you give us a couple examples of how your customers are using the content that you provide them? Obviously, serving up COVID-19 content is happening on every website. I mean, even my tennis shoe vendor is, providing information about COVID and how it impacts my relationship with that vendor, which sounds strange, I realize. but healthcare definitely would be able to use the kinds of content that your writers are producing. How are they using it, and what kinds of examples might you provide?
Well, a lot of them are using it just how we have a coronavirus resource center. A lot of health systems or hospitals have their own coronavirus resource center, and on that, they'll have visitor information, which is, as you know, changing constantly. And then they might have a video, which again we create, and then they might have some short FAQs. They might have an article or two. They might have an infographic. All of that, so they're using whatever content we're creating alongside with their content on their web pages, so that it's really for them to use how they need it. And then you'll see a lot of social media. A lot of our clients are using our content on social media, and and then they're using. But really, what this content as a service really allows them to do is take health education and weave it into their website wherever they need it and wherever people are looking for it. We do have a client that uses our health education a lot for SEO to get people to their website. So, if someone's typing in back pain, they will be able to use our health education to get them to their site. And then once there, maybe they'll make an appointment, maybe they'll call for more information. But really, it's to help our clients be the trusted source of health information, so that people don't have to go to Dr. Google. They don't have to go to crazy fake news websites to get the health education.
That's really interesting. And as you're talking, I'm thinking about all the different places and all the different sites that your content is sitting on. And it makes me wonder, what kind of taxonomy do you have that melds in with all of these different taxonomies of all these different sites? How does that work?
Well, the taxonomy side is huge, and we have had clients who have wanted to just license our taxonomy, which we do not let them do. But it's, that's the difference between, let's say, finding and searching for information. If you don't have the taxonomy behind that supports that, especially in the healthcare industry, forget about it. So we have our taxonomy is built out quite a lot. Again, we have had people who just want to license it, but it is extensive, and it drills down into any and every specialty, anything people might be searching for, and the content is all organized that way. That's another thing that you have to think about as you build structured content, is how are people going to find this information? How are you going to use it so that you can find this information when you need to update it quickly, when things change? And without having that taxonomy behind it, that might be what the missing piece that people are missing, because that can be the difference between success and failure.
That's great advice, and you're spot on with that, of course. And speaking of taxonomy and being able to find information, this is actually maybe a good time for us to mention that today's show is sponsored by Zoom In Software. Megan, could you tell our audience a little bit about Zoom In Software, what it does, and how it can help them tackle some of these similar kinds of content challenges?
Absolutely. And yes, we are all about finding content quickly and using taxonomies. Our platform ingests technical product content from any source, no matter how it was created, structured, unstructured, whatever. And we deliver it into a documentation portal, a community, a customer service site, and even into the product itself. And so by doing this, customers are able to self-serve more efficiently. And that means that organizations can then reduce support costs and improve product adoption.
Right. And so this is good. And it could be used in a medical setting just as easily as it could be used in
Absolutely.
a technical
Yep.
documentation setting.
Yep. We've got some customers who are medical. Yep.
Yeah, that makes perfect sense. So it seems like it aligns nicely with what Sonja's team is doing. And speaking of Sonja's team, Sonja, you told us in an earlier call when we were kind of prepping for this show that your team won an award. I thought that was very interesting. What was the award called, and what did your team do to earn it?
Yeah. Well, and I just found out we won 6 more awards on Friday.
Wow.
I know. So, so it's kind of cool. I know. Yeah, I know.
That's awesome.
Wow. The awards that we won are the Clearmark Awards. So they are recognizing the best in plain language communication. And so it's really all about creating content that people can use and understand, right? So a lot of health education, a lot of health information is written at a high, maybe grade level, and that makes sense, right? Because physicians are, highly educated people, and a lot of physicians are creating health content. But the issue there is that if consumers can't understand it, they can't use it, they can't follow it, the health outcomes remain bad. So we create health content that people can use to hopefully create better health outcomes. And so that was the Clearmark Award. On Friday, we won 6 digital health awards. So that is just recognizing digital health and how you present the best in digital health. So we won 6 awards for our content there, which was very exciting.
And just out of curiosity, do you think that the recognition that you got is because of the way that you're able to deliver this information as well, not just the fact that it's good quality information, but that you've got it structured and you're able to serve it up in these different innovative ways?
That is what the digital health awards kind of look at. The Clearmark Awards are all about writing the clear evidence-based content so that people can understand it, and really quality content. But yeah, I mean, I think that, you have to, like I told you before, we started health content, we started health education, health content in 1975 with books, right? We had to change the delivery of that health education. So you can't just, sit back and say, well, this is what we do. We create books. With health, you have to say, no, what we do is we help people make better health decisions and live healthier lives. And how can we do that? And you have to work within the technology that's now, today's world. You can't sit back in your old world and say, oh, well, we're not going to do any of that. That's for someone else to do. And so we didn't. And that's why I say we have software engineers, software developers, integration engineers that help us, take this content, this great content, and distribute it in several different ways and deliver it in different ways so that people can use it and that people can get to it. And that's what we're hoping to do. And we do have, software clients who want to build a health app. Well, they don't know anything about creating health content, nor do they want to. That's not their core competency. And so if we can say, hey, we have structured content, you can use it however you want to. You can fit it into voice recognition. You can use it however you need. That helps them be able to take that health content and deliver it in their app or however they want to use it.
Super valuable. And
Yeah.
congratulations to your team, by the way.
Yeah.
Oh, thank
Big
you.
congrats. That's awesome.
Thanks.
That's really, really impressive.
Yeah. Thank
Very
you very
cool.
much.
Yeah. So I think one of the things that you mentioned that I'm interested in is you use the phrase evidence-based.
Mhm.
And we kind of know today that a lot of information claims to be evidence-based and there's really no evidence behind it. So
That's right.
what does that mean, evidence-based, exactly, in your world?
Yes. So yeah, you're right. That's a loaded question. I mean, that's a loaded thing sometimes. But how we define it is we are strict about what journals and what research we use. So we have specific, very specific sources for where we get our information, and then we use that to write our content. So it's let's say, for instance, there's a study done, and someone brings it up, and it's on NBC News. Nothing wrong with NBC News,
Right.
but we will look at that information and we will say, what was this study? You know, how many people were involved in it? What was the background of it? Is it actually valid to then change our health content, or is this something we just need to look at and monitor
Right.
for more studies? So it's really about, studying the evidence, and that's, our medical content specialists, that's what they do. So every day they scan through for their areas. They scan through what's the new things that have come out. What are some new studies that have been published? What does that mean for our content? Does that mean that we change it? Does that mean that we watch it? Does that mean that we update it the next time? And I think that that's something that is really important in today's world, is really looking at what is the evidence behind this and where did it come from.
Right.
And so that's what we do.
Keeping track of that, all of those moving parts can be a big challenge. And speaking of a big challenge, this whole year really has been a big challenge. For people, I actually can't. Let me see if I turn my devices off. So I did. So I think I can get away with saying this. I'm just going to use a different device name this time than what I normally would. But I heard somebody say the other day, Siri, skip to 2021. Right?
So
Can we
true.
do that, please?
It's
Yes.
so true.
2020
Yeah.
is a big challenge
Yeah.
for us, especially with COVID-19. How did the pandemic impact your work when it first started? I mean, it seems to me that this would be like one of those moments for a healthcare information company where you're like, okay, well, let's see if all of our stuff works.
It was crazy. It was crazy. It was a lot of long days and nights, because this is impacting our clients directly. This is this is huge for them, and they're working so hard to try to serve their consumers, their customers, and there's very little information to do that, right? Information from the CDC was changing every day, so we were following it, and we were making those changes as soon as they came out. We were really trying to give people any information that we could in any way that we could. One of the things that I talked about before was so one of the awards that we won was we wrote a storybook for kids based on the coronavirus. Charlie learned about the coronavirus.
Cool.
Yeah, because I mean, think about their world.
Oh.
Think about how scary it is for them, and they don't have any resources,
Right.
And so that was something that we did, and that storybook was used, and we've heard from people, people have used it in their schools.
Yeah.
People have taken it and used it, with whenever they are talking about the coronavirus, our clients. And so I think that it's just really looking at like what is anything that people would need at this time, and then creating that content. And so that's what COVID was. And I mean, COVID was, and it still is. It's changing all the time. And now we're writing information about the vaccine, so that people have that information.
Wow.
So I think it will
cool.
just continue to to change, and we have to do that. We have to change with with it so that our
I see
clients and
another
people have
another award in your future, by the way, for that.
Yes,
Child,
perhaps
and I'm
we'll
also
come up with one.
I'm having flashbacks to Sesame Street and Grover, the character,
Ah,
because they used to explain to us. Remember when things were going on? They
yes,
would talk about war, and they would
yes,
talk about protest, and they would explain
yes,
yeah,
what's going on in the news. So I
yeah.
think that you're spot in line with what children need. That's a really
You
great.
know, I love that you focus something on children because, to your point, if you think about how difficult it is for adults to wade through all this information and
mhm,
decide what's right and what's wrong and what we should be scared of and what we should be
right,
okay with,
Yeah.
for kids, it's so much bigger. So I have an 8-year-old who plays hockey, and one kid on his team was the one kid that always wore his mask, and he's the one kid that got COVID. And so he was talking to my husband, and my husband said, well, what does that mean? And he said, well, that mask caused COVID. You're like, no, that's not the
right,
right lesson, right?
right,
Like, we need to back up.
Yeah.
Let's actually talk through this, right?
right,
But they just come up with these weird insights that you're just like, that doesn't make sense. But then you look at adults coming up with weird insights too, and
right,
it's all crazy.
Now
So
we know where they come.
what an ordeal. Yeah.
right.
So thank goodness we have your information
We've
that
got
we can go to.
We've got tons of questions, Megan, from the audience. Would you like to serve up one, and then we'll just take turns and try to tackle as many as we can?
You bet. So one of them goes back to our talk about taxonomy.
Mhm.
So how much of your taxonomy is applied in the source structured content,
Oh, good
and
question.
how much is applied after you publish or generate or produce the output from the structured content system?
Mhm. Well, I mean, I honestly don't think you can separate it because I mean, we built it using the taxonomy, so everything was built based along the
Right.
taxonomy
Right.
and that organization of information. Um, but our clients also use that organization of information, right, to
Mhm.
when they're searching. So I mean, that's a hard question. I don't know how you would separate those, but I do know that we started with the taxonomy.
Okay. But you said you don't license the taxonomy. So presumably your
Well, we
customers
do. We
have
license,
different.
right. We
Oh, go
license
ahead.
it if you buy our content as a service, you get the taxonomy.
I
We
see.
have
Oh,
had
I
not a
see.
separate
clients
product.
who have just
Got it.
wanted the taxonomy
Okay.
and
I
not the
see.
health content behind it.
Got it.
Okay. This
Yeah.
person asked further, do the authors working in structured content management system apply the metadata tags, or do you have taxonomy and metadata specialist roles to apply or validate the tagging?
We have
Mm.
we already have people who strictly work on the metadata tagging. So
Got it.
and that's not just in structured content, that's in all of our content. So that's
Very nice.
yeah.
What structured authoring tool do your content creators use? Are there different ones? Because you mentioned so many different people, I wonder if it's in a technical communication environment.
There's different
Sometimes
ones.
the chief technical writers are writing with kind of a specialized tool, and maybe contributors that are experts in some other area, they
Yeah.
might not have the domain knowledge to use those tools, so they end up using different ones. I see you nodding your head. Can you
Right.
explain what's that? How's that work there?
I'm just laughing because we all use different stuff. So but they don't. I mean, all the content creators use the same software.
Okay.
I don't use it because I am not in that. I do not create medical content, so
Right.
I don't use what they use. So I don't want to talk about it because it's not. I don't have any background with it. However, I could find that out and send it to you after the show.
Perfect. Perfect. But I like
yeah.
the answer anyway that lots of people use different tools. I think that's common in many
Mhm.
organizations, and bringing everything together because you have this structured content approach. I think you've probably developed a workflow that allows that content to travel from where it's created to where it's needed,
Yes. Yes.
whether you're doing it or I'm doing it or somebody else is doing
Right.
it.
And like I said, they all use the content team. They use the same software.
Yeah.
We use different software because we're in marketing.
Sure.
And, so.
But we love that. The whole fact that you're in marketing and structured content is coming out of your mouth is an amazing thing because we've been
It's
trying
awesome.
to say, of course, marketers should be using structured content. It's just so
Well, yeah.
obvious.
Right.
Nice. So I'm going to throw this one to you, Scott. Someone's asking, is there a simple metaphor from, say, cooking or sports that we can use to help decision makers understand structured content?
Yeah, probably that. You would think it'd be really simple, but for whatever reason, my brain hasn't kicked in, and my caffeine is not powering my brain here. I'd say that the way that people use recipes. The reason that people use recipes as an example for structured content is because it's a common thing that all human beings should probably understand, because we eat and we consume food, and it's often prepared with a recipe in mind. So we use the recipe as a cooking metaphor, and we explain that there are different parts of the recipe. It's not just one thing. It's actually a list of ingredients. It's a units of measure, certain quantities, and then instructions for preparation and the tools that you'll need in order to create the content. And when you have all these things modularized, you can say, bring them all together, just like Sonja's team can bring the healthcare content together. And you can create a short little recipe that just has the ingredients and some short instructions, or you could provide a more detailed one that includes information about the tools you'll need. Maybe you'll need a whisk and you don't have one, and it would be helpful to know that you needed that in advance. So structured content allows you to mix and match in ways that are really creative. And with recipes, the important thing to know is that people make decisions on what to cook based on lots of things other than the recipe book. They say, I only have these items in the cabinet. What can I make with this? Or I only have 15 minutes. Or my guests said they preferred Italian food. How do I find all the Italian recipes, but I have 15 different kinds of cookbooks and not one of them is an Italian cookbook? So by knowing that those things are Italian or Mexican or traditional American or Chinese, you can sort and filter them very quickly. And so if you would like to sort and filter your company information very quickly and give your customers the ability to build those things on demand, you can mimic the recipe kind of model. I have to do a show about that.
Yeah. No, that was really well done. Really well done.
All right. Do we want
One
to?
last question?
Yeah, there's one.
We have time?
Enterprise delivery mechanism, always an API, one of our viewers wants to know, or do you have any integration or consulting work that connects the content to a specific CCMS or other distribution channels?
It's not always API. We have several different delivery methods. So we also have hosted content and self-hosted content that's delivered in various ways. We have to work with, let's say, for example, we're working with a health system and they have an EMR. We have to be able to integrate our health content with that EMR so that they're able to pull it up in their workflow. So we work with the leading EMRs like Epic, Cerner, Allscripts.
For our audience members, I'm sorry to interrupt you, but for our audience members that don't know what an EMR is, I assume you're saying electronic medical records.
Right. Electronic medical records, and it's what clinicians work in all the time. So you have to be able to work within their system. We also have to be able to work in with CMSs so that we can deliver our content to whatever CMS that their website is using. So let's just say Drupal or WordPress or something like that. So we work with all sorts of different systems, and that's why we have so many integration engineers, because we also work with health plans systems and integrate our content into that.
And that's got to be complicated, because as a patient, I've personally got really to know the brand name Epic, which I should not know as a patient, but I know this because I've heard the healthcare professionals either say, oh, thank goodness this system is working today because it's really useful. And then I say, what system do you use? And they say Epic. Or they say, this stupid thing doesn't communicate the way it needs to. And what I've learned is that there's different flavors of all those software too. Some companies or healthcare organizations have older versions of that software. Some have more advanced versions. So you're probably also kind of like a little moving target, right? Where you're aiming.
You know it. So it's always, I mean, it's always a challenge, which is thankfully we have our integration engineers who, they really work with our clients one-on-one to make sure that it works for them, and get them to where it will work for them. Because if it's not integrated into their system, they will never use it. Like, that's just not going to happen.
Well, I'd like to give a little round of applause to the integration
Yes.
engineers, because I know how hard that job can be. And it's not just the content creators and the subject matter experts, but everybody in that chain is responsible for helping deliver that information to the right person at the right time in the right format. So that's really good. They deserve an award too. I think
they do.
This has been really, really interesting hearing about your process. Just I'm in awe of what you do.
Oh, well, thank you very much. I mean, I don't do it. You know what? I work with a great team of smart, professional people, and I will say that HealthWise is it's the best organization I've ever worked with smart, passionate people who know what they're doing. It's just great. Yeah.
Well, we'll leave that as the last word today. That gives you a nice little positive closing there. Megan and I'd like to thank you, Sonja, for making time to be on our show today. We appreciate you being our guest, and I know our audience does too. And thank you to the audience for being here. We really appreciate your commitment to these short shows and sharing them with others, which we hope you'll do after the show.
Yeah, thanks for having me.
Thanks, Sonja.
All right, and before you sign off, we'd love it if you'd let us know what you thought of today's show. You can use the Rate This tab located in your webinar viewing panel to give us a 1 through 5-star rating and leave any comments that you may have about today's show with Sonja. And before I go, I'd like to encourage you to be on the lookout for your invitation to our next The Content Advantage show, which takes place Tuesday, December 8th, 2 weeks from now, when we chat with Kevin Nichols of Avenue CX about the customer journey and how to map content to the various channels that you'd like to deliver to. Until we see you again, stay safe, be well, keep doing good work. We'll see you again on a future edition of the Content Advantage Show. Thanks for joining us.
Ensure your customers find the answers they need with Zoomin. Zoomin. Bring together product content from all teams and sources to deliver a unified, personalized content experience. Check us out at www.zoominsoftware.com.
Thanks for joining us.